Here at your community station, we've launched a new segment called Revive and Thrive, stories aimed at wellness and health. And today we're focusing on the Great American Smokeout. It's an annual intervention event on the third Thursday of November. And the focus? To help people quit smoking. This morning, we're joined by Dr. Edan Wernik, family medicine and smoke cessation leader at San Jose's Kaiser Permanente. Welcome, doctor. Let's start by going over the details of the Great American Smokeout. Is it effective, and what's the goal?
Hi, Nicole. Thanks so much. I first want to recognize that every day should be a tobacco cessation day. That's what I care about every time I meet a patient who is smoking or affected by tobacco-related illnesses. And so today's goal is really to highlight the health effects of smoking and really the heavy burden that our country takes as a result of many years of people using tobacco. It's the #1 leading cause of preventable death, and there's close to 480,000 people who die every year from tobacco-related illnesses. On the bright side, there are extremely effective ways to quit smoking, and the Great American Smokeout that's been kind of recognized and celebrated since 1976, it's almost 50 years now, is really putting together a bunch of those resources for patients to learn how to connect to coaching, to quit tools, quit support, and medications. And it's extremely effective if you can combine those measures together towards a successful quit.
Well, you mentioned all the ways. We know addiction is not easy to shake off. So what is the best or easiest step one for someone looking to quit?
Step one is to make a plan. I think that just doing it all alone and by yourself is difficult. And quitting cold turkey hasn't really shown to be successful. So your plan should really include using the resources such as coaching or quit lines or tech support, as well as the FDA-approved medications that will help you quit, the nicotine patch, nicotine gum, and a couple of the oral medications that we can offer. Start with a plan, and today could be your day one in that path.
Well, like alcohol, tobacco is really easy to find pretty much at every convenience store. So what can recovering addicts do to avoid that temptation?
Well, fortunately, we live in a state where there are fewer tobacco users than nationally. We're at about 10%, though there are many situations where you're going to be exposed to those smoking around you. Part of your plan and part of working towards quitting is also creating a support system and a network, letting your family and friends and coworkers know that you're on this path. That's a difficult one, but they should help you and not create situations that would be tempting and continue to expose you to smoking. The other part of it is really learning to separate past activities that have always been part of your smoking habit, such as sporting events. Is it drinking? Is it times of stress, times of excitement, times of boredom, and finding different ways to manage those situations without a cigarette?
Well, thank you so much for joining us this morning, Dr. Edan. Don't be a stranger.
Thanks so much.